we have with us Dr. Kenneth Kearstan, Chiropractic Physician here in Somerville, and who also has a specialized degree in Sports Medicine and Rehabilitation. Dr. Kearstan's focus has been stretching as an integrated part of his chiropractic care and physical rehabilitation. As you watch here today, what you'll find is that these are not your basic stretches that you're going to be looking for. This is the state-of-the-art stretching that is not only good for your health, welfare, and well-being, but is also good and curative for many healthcare conditions. Stay tuned and stay focused. Also, Dr. Kearstan renders his services of rehabilitation to high school sports teams and above, and is available to coaches for consultation. Dr. Kearstan, welcome to the show here today.
Thank you very much.
As per Dr. Kearstan's prescription, he's got a lot to show you tonight, so we're going to cut right to the chase. With us today as Dr. Kearstan's assistant is Ellen, a local fitness instructor here in Bridgewater who's very well known for her physical prowess.
Okay, let's get started. Today we're going to address some major muscle groups. The muscle groups that we're going to incorporate here today are muscles that are prone to tightness and weakness. What I mean by that is these are certain muscles in our body that, due to the way we live our lives and the way we do our activities, have a tendency to become very tight. These muscles are our postural muscles, the muscles that keep our bodies standing up and maintain our posture. The first one we're going to begin with is the low back, including the lower extremity. This muscle is tight in people that sit a lot, and we're in a sitting society. People drive trucks, we have long commutes, we sit at our desks. When your leg is in this position, it's in the shortened position or having the muscle being contracted. When this happens, this puts a lot of pressure on our back when we stand up. And people feel it when they get up from their desk, they feel tightness in their back, and it's really because it's extending from the tight hamstrings in the back of the leg. So we're going to incorporate a stretch called PNF stretching, which is called proprioceptive neuromuscular facilitation. This means that we're not only going to stretch the muscle, but we're going to re-educate the muscle and allow it to normalize and train it to what it should be doing, which means contract when we want it to move and relax when we need it to relax. The problem we're having here in these postural muscles is that they're continually contracting or becoming fatigued. Lactic acid builds up, we get cramping, muscle spasm, trigger points, and this puts a lot of pressure on our low back. So let's get right to the first stretch. We're going to raise the leg, and Ellen's going to tell me exactly when she just feels a tightness in the back of the leg or the back or right behind the knee is a common area. We want to be functional, which means be functional is that we want to be between 60 and 90 degrees of flexion. This will allow us enough play in that it doesn't put much pressure on the back. So we're going to get up to about here is where she starts to feel tightness, right. Okay, which is pretty close to functional, but we still need to go about another 20 degrees. What we're going to do is she's going to do a contraction relaxation, which means she's going to actually activate this muscle against some of my pressure so that we contract the muscle, and then we're going to relax it, shut it off, and stretch it. We're actually fooling the muscle into relaxation here. So what she's going to do, I'm going to get underneath here at my shoulder because it's a big muscle, so she's going to put some pressure down on me. You're going to press almost to your full strength. You're going to feel some tightness in the back of your leg. You're going to hold this for approximately 10 seconds. At the end of 10 seconds, you're going to relax, exhale, breathe out. The reason she is exhaling is this exhaling or breathing out facilitates or helps a muscle relaxation. It's very important to breathe during all these stretches. We're holding at our new boundary now. She couldn't get this high before. She's stretching now. She's going to push again now. 10 seconds. She's going to relax, exhale again. We're going to bring her higher. Now we're pretty good. We're about 80 degrees here. Now, I'm going to make it a little harder on her now, and we're going to stretch this calf muscle out at the same time so she feels more tightness in the back of the knee. At this point, she's going to push up on my hands like she's pressing on the gas pedal and push down on my shoulder at the same time. She's going to hold here for 10 seconds, and she's going to relax and exhale. Very good. She's going to feel some tightness and some soreness.
Oh, yeah.
But this is okay. Very good. We're going to continue that, to do that 3 times at approximately 10-second holds, 10-second stretches, with a repetition of 3 to 5 times on both sides. The next muscle group we're going to address is the lumbar paraspinal muscles, or the low back muscles. These muscles run from about the middle of the back down all the way to the tailbone or the sacrum here. This is a very large group of muscles. It's very strong, and it helps support the whole abdominal area and keeps our posture good in our low back. Now these muscles could become very tight, and this could become secondary to the hamstring muscles being very tight. What I mean by that is the hamstrings, when very tight, attach up to the ischial tuberosities here, or the bones that we sit on, and can actually posteriorly rotate or create a constant pressure, rotating the pelvis backward. This in turn will put strain on the lumbar muscles or flatten our lumbar spine out, and we don't want that to happen. That makes our muscles very tight and weak. So we not only have to address the lumbar spine and the hamstrings, we have to do that all together, not just one of each, okay? So this is the next step, what I do. We're going to do a basic knee to chest stretch. Now a lot of people do this at home, and people can do this and they feel pretty good. So everybody's kind of familiar with this stretch. What we're going to add to this is our hold and relax and our breathing. This is going to help, again, facilitate the muscle relaxation and get a good stretch and get a better stretch in there, okay? And we're going to do the knees simultaneously on this one to get both sides of the lumbar spine. We're not going to isolate or torque the pelvis here. We're going to do it all at once. So what we're going to do here, Ellen, you're going to bring your knees up to your chest. You're going to feel to the point where you just feel that tightness in the small of your back. Is that where you feel it?
Right.
Okay. Yes. Now what you're going to do is we're going to add a resistance against me. So you're going to push against me like you're trying to push me off or through the door here. She's going to hold this about 10 seconds, again, just about sub-max until she can tolerate it, until she can just feel that tightness in the back. She's going to relax, exhale again, and I'm going to scoop under and roll up. We're creating a tractioning of the lumbar spine here, gapping the segments and stretching the muscle at the same time. And she's going to relax again, and we're immediately going to push again. I'm going to put a little more pressure, get her up further, and she's going to give me my resistance again. She's doing good. And she's going to relax and breathe out. Please note when you're doing the contraction here, she's maintaining a good steady breathing. It's just that when she stretches, we exhale to help facilitate that muscle relaxation again. Very good. You okay?
Yes.
Good job.
Feels good.
Okay. And again, we're going to repeat this 3 to 5 times to her tolerance until we get a good motion in the back there. The next muscle we're going to address is still part of the low back muscle, but it's one of our rotator muscles and another stabilizing muscle in the low back. This is called the Quadratus lumborum muscle, and it runs on the sides. People get this feeling where they feel it kind of tight and spasmy right out in the side when they twist or turn. And this is another important muscle, and again, stabilization and movement and function. And again, it's one of our phasic or postural muscles. This muscle is also prone to significant tightness. This position, she's actually going to turn on her side, so she's going to face this way. Okay. And we're going to twist her a little bit in the upper back so that she's almost flat. Now, if you guys watch a football game, you're going to see this happen in they do this a lot of athletes on the sidelines. They get on the side, they get a cramp in their back, and they're going to go land on the ground like this, and the trainer's going to come up and stretch them. This is the muscle they're working on. She's going to kind of scoot a little bit to the end of the table here, and she's going to be in a comfortable position. Right now, she should be feeling a little pulling in the back or the lumbar spine and kind of into the butt a little bit here, okay? What we're going to do is we're going to activate this muscle and then relax it. So she's going to kind of curl up in this position, and she's going to place some pressure that's going to push up on her knee towards the ceiling, and we're going to resist against that. So she's going to press up against my hand here. Again, she's doing a pretty good contraction here, and she's pressing directly up to my hand, and she's breathing nice and easy. And now she's going to relax and breathe out, and we're going to put a little pressure here downward. She's going to relax, and now we created a new boundary here. She's going to push up from this point on. Push again. It's getting a little harder now for her.
For you
but
too?
She's doing good. It's getting harder for me too. And she's going to relax and push down. Very good. And we're going to repeat this about 3 to 5 times to her tolerance until we get a good stretch in the muscle. Okay, now we're going to move up into the neck and upper back area and the pectoral group, or the chest muscles. These again are muscles that are prone to tightness and weakness. And not only can an ankle pain, knee pain, or problems in the lower extremity lead to low back problems, but it can progressively work all the way up into the neck and cause headaches. Again, everything in the body is connected, and it could, over a period of time, work its way up and causing compensatory spasms in associated or connecting muscle groups. So we have to address this part too. This is a muscle that everybody complains about. The trapezius muscles, the shoulder muscles. Sitting at the desk, this is where everybody holds their tension. It's not a coincidence. This is, again, a phasic muscle. It's a postural muscle. It keeps our shoulders back. But with people sitting at desks, working at the computer, having their head turned, this muscle is chronically tight. Okay, and we have a lot of little knots in the muscle, or trigger point muscles. These are the muscles that these are the points in the muscle that build up due to fatigue and tiredness. So we get a lot of spasm in here. We're going to stretch that muscle again using the PNF technique. Okay, so I'm going to have Ellen do. She's going to let me slip my hand underneath her head here. This muscle runs up. It's a very large muscle. It runs up from the shoulders, traverses the neck, and up behind the ear here. Okay, so what we're going to do is we're going to incorporate a shoulder shrug, and we're going to contract that muscle, relax it, and shut it off. We're also going to work on a muscle called the levator scap muscle, which is associated with the scapula or the shoulder blade. Again, that's where you feel that pain between your shoulder blades, and you feel that tightness in there, like you feel like you got a knife in your back. That's what we're going to work on too with this stretch. Okay, so we're going to do one shoulder at a time. What she's going to do is she's going to put some pressure into my hand up to her head, like she's shrugging her shoulders. But she's going to do one at a time. Her head's in a neutral position. Again, she's giving me some good force here. And then she's going to hold it for about 10 seconds. She's going to relax, exhale, breathe out, and I'm going to stretch up like this. We're turning the head the opposite way to stretch the right trapezius muscle here. And hold that for 10 seconds and relax. We're going to start over again. She's going to push up again. We always do the contraction with the head in neutral position to avoid any spasm or cramping. And she's going to relax, breathe out, and we're going to go a little further this time. Good. She's going to push up one more time. We're going to incorporate that levator scapular muscle, which I mentioned before. The only difference we're going to do here, she's going to relax. We're going to turn the head to the ipsilateral side, the same side, and bend it up. She's going to feel this more in the center of her back, or right behind her shoulder blade. Good. Again, we're going to do this 3 to 5 times, each side, with a 10-second hold and a 10-second stretch. The last muscle group we're going to work on is the pectoral muscle group, or the chest muscles. These muscles become very tight. Again, people wind up shrugging their shoulders forward, and that's because of the muscles in the chest become very tight. So we're going to work on that too. And we're going to stretch these out by extending the arms outward like this. Now, in a relaxed position, Ellen's actually pretty flexible in this position. We should be at least even with our body or past it. We should even go a little past it when relaxed. So this is a way to test yourself at home. If you put your arms out and you're on a bench and you're only about here, that means you got some tight chest muscles, and we need to stretch those out. Okay? We're going to incorporate the hold and relax technique here again, and we're going to work on the pectoralis major group, which is the big muscle in the chest. We're going to position the arms directly on either side of our bodies. She's going to put some pressure up on me. Again, she's going to feel, now she's like when you're in the gym and you're doing the flies or that type of muscle, she's going to feel that type of soreness in here. She's going to relax, breathe out, and we're going to bring down. And this table's blocking me here a little bit, and as if it wasn't, we would be able to get her arms a little further down. And we're going to repeat this about 3 to 5 times in this position. She's going to relax. Good. Next, we're going to move on to, again, we're going to stay within the chest group, but we're going to work a different muscle. This is called the pectoralis minor muscle, and it's going to be the same stretch, same mechanics, but we're just going to change the arm position. Okay? So it's going to be up on an angle if she's reaching for the corner of the rooms. Some people could be very flexible here, have no problem, but once they get up here, they're a lot worse. This is a muscle that's underneath, and this muscle is more prone to tightness. We're going to incorporate a hold and relax stretch again. So she's going to push up against my hands here. Please note too that all through these stretches that she can actually help facilitate a muscle contraction relaxation with movement of her eyes. It helps relaxation. So when she's pushing up, she's going to look up. Look at me. Good. Keep pushing. And then you're going to relax, breathe out, and now you're going to look down. That also helps with the relaxation, so keep that in mind when you're stretching. She's going to push up again. 10 seconds. And then she's going to relax and exhale, look down. Very good. Excellent. Good job. Now that we address what we do inside the office, or what I do with one-on-one with a patient, we have to address what we can do at home. A common question I get is, Doc, what can I do at home to help myself get through the day, or when I have cramps or spasms? And that's what we're going to talk about right now. We're going to incorporate some hold and relax techniques that you can do yourself to help copy or mimic what we did in the office. It will help you get through those tough times when you're tight, you're stressed out, and by doing this at home, this will help facilitate or re-educate those muscles and keep them at a flexible level. What you do at home is more important than what we do in the office. That helps the treatment that we do in the office last longer, and it will keep you out of the office also. So this is going to be a very important part of the program, and enjoy. We're going to get into the home portion part of the stretching program. We're going to do a stretch here where we're going to work on Ellen's trapezius muscle. This is the upper back muscle, which has a chronic tightness problem. And we're going to demonstrate a stretch that she can do at home so that she can get through any periods of tightness or to maintain her flexibility on her own. Ellen's going to hold on the side of the chair underneath. She's going to put her left hand over her head. She's going to begin an isometric contraction, which means she's going to contract the trapezius muscle without moving the head. She's going to move this contraction to her right-handed side. She's going to hold this contraction for 10 seconds. At the end of 10 seconds, she's going to relax, exhale, and pull the head to the left side while leaning away, maintaining a traction at the bottom of the chair. This is a passive stretch which will allow facilitation or relaxation of the trapezius muscle. She will repeat this contraction 3 to 5 times, 10-second holds, 10-second stretches. This stretch is obviously done on both sides. The next muscle group we're going to be demonstrating is the pectoral group. This involves the pectoralis major muscle and the pectoralis minor muscle. This muscle is also prone to tightness. The first demonstration we're going to do is the pectoralis major group. This involves a doorway stretch. So Ellen, walk up front, turn around. The hands are placed at about shoulder height, directly on either side of the body. Ellen's going to put some pressure into the doorway like she's trying to push the doorway over, about half of her strength. She's going to hold this position for about 10 seconds. At the end of 10 seconds, she's going to exhale and gradually take a step forward, stretching the muscle. She's going to hold this position for another 10 seconds. At the end of this 10 seconds, she will press at this point again into the doorway, further stretching the muscle. She will then take a smaller step forward, further stretching the muscle. You're going to repeat this 3 to 5 times, or to your tolerance. Just that means to when you feel you've gone too far. The second stretch involves the pectoralis minor muscle. This is also the chest muscle, and it involves the same mechanics as the pectoralis major muscle stretch, except with a hand position change. The hand position change is going to be angled more towards the corners of the doorway. You could do this in any doorway. This is a wider doorway, which will give us a better stretch, but this will just change the position of the hands with the same mechanics. So Ellen's going to press into the door, hold for 10 seconds, relax, exhale, and walk through. And she will do this 3 to 5 times with the same technique as she did with the first stretch. The next stretch, we're going to move to the lower extremities and the hamstring muscles. This also incorporates a doorway, and we're going to stretch the back part of the leg, which is the hamstring muscle group. We're going to lie in a doorway position where one leg is into the hallway, and the other leg that we're going to stretch is going to be placed up on the door jamb. So Ellen, put your leg up on the door jamb. She's at a comfortable position now where she should be at a point close enough to the doorway where she feels a tight pull in the back of the knee or the back of the leg. Is that where you feel it, Ellen?
Yeah.
Okay. This is our starting position. She's going to make sure that her toe or foot is pointed towards her body, not pointed. in this position. Now she will put 50% of her pressure into the door as she's trying to push over the doorway. She's going to hold this for approximately 10 seconds. At the end of 10 seconds, she's going to exhale, and she's going to scoot her body closer to the doorway, thus bringing her leg higher up on the door, giving it a stretch to the back of the leg. In this position, you want to make sure that your pelvis or your hips are flat on the ground, and the leg that is through, laying flat on the ground, is not bent. You want a scissor type action. This will isolate the hamstring nicely and give you a good stretch. She's staying in this position for 10 seconds, allowing it to stretch, breathing evenly. She will now push again with her new boundary. Push. Hold for 10 seconds. She's going to exhale and scoot again closer to the door. She's going to repeat this 3 to 5 times, or until she reaches a comfortable level. The optimal position would be the leg flat against the door, that you're 90 degrees from the floor. Obviously, this is done on both sides. The next muscle group we're going to demonstrate is the calf muscle, or the gastroc group. This is the muscle that ranges from the bottom of the knee to the ankle. All you need for this stretch is a bath towel, beach towel. You're going to roll it up, as Ellen has it. She's going to wrap it around the ball of the foot like a stirrup. What she's going to do is going to get the ankle into a position where she just feels a little tightness in the back of the calf or behind the knee. She's going to press onto the towel like she's pressing on a gas pedal or accelerator. With 50% of the strength, as before, she's going to hold this for approximately 10 seconds. At the end of 10 seconds, she's going to exhale and pull the towel towards her body, thus stretching the calf muscle out. She's going to hold this stretch for approximately 10 seconds. Well, she will then press down again like she's pressing a gas pedal for 10 seconds, and then pull up again, further stretching the calf muscle. She's going to repeat this 3 to 5 times, or to your tolerance, and obviously done on both sides.
After those stretches, I'm sure that we can all walk away with something here tonight. Believe me, if you do incorporate these stretches into your lifestyle, you will eliminate a lot of time in the doctor's office in the future. You will eliminate a lot of medical expenses, and your total life will be a lot happier. Thank you for joining us here today, and thank you, Dr. Kearstan and Ellen, for being on the show today.
Thank you.
And I'm Dr. James Golding for Natural Healthcare Alternative. See you next time.